Do you want to take an active role in improving your mental and physical health after a prostate cancer diagnosis, decrease side effects like fatigue and urinary leakage, and improve your chances of not dying of prostate cancer? Then PC-PEP, the Prostate Cancer Patient Empowerment Program, is for you.
PC-PEP grew out of my lab's research studies showing that men affected by prostate cancer suffer from high rates of treatment side effects, which can negatively affect their mental health and quality of life. So we engaged the community. We engaged patients and partners, urologists, oncologists, stakeholders, and other experts, and created a home-based, comprehensive program tailored for prostate cancer. Since then, we conducted and published several scientific studies, including a pilot study testing and showing that PC-PEP is safe and feasible, and also the results of a randomized clinical trial of 128 patients testing PC-PEP against current standard of care. The results of the study shows that PC-PEP improved mental and physical health, urinary function, and overall quality of life. The feedback we received from the PC-PEP program has been incredibly positive from the men in the program, their partners, and their doctors.
My wife and I had the benefit of being a part of the development of the PC-PEP program, and we're going to be sharing some of our experiences.
So in this video, you're going to learn all about the program and find out what you need to do to get started.
And I'll be sharing some of the things that were particularly helpful for us.
PC-PEP is meant to start before any treatment begins, although men can do this program at any point on their journey. We believe that men undergoing treatment, whether it be surgery, radiation, hormone therapy, chemotherapy, or active surveillance, will benefit from this program and experience increased energy, better cognitive function, and overall improved quality of life in the long term.
Once you've been cleared to participate, you can start the program. You will receive an email every day for 6 months, which tells you what you should be doing for that day. In the email is a link to a 4-minute YouTube video which contains our daily message, in which Gabriela and I try to put some pep in the PC-PEP. We provide the scientific background for the program, provide advice on the anti-prostate cancer diet, and tell you about how to stay connected with loved ones, and much, much more.
Most guys in the program read their emails and watch the video first thing in the morning with their partner if they have one.
Yeah, and the videos are entertaining and very positive and really informative.
The program is set up on a weekly schedule and composed of 5 major activities. First is aerobic exercise. We want you to get out there almost every day and get your heart rate up and a slight sweat on the brow and really get yourself going. And even if you power walk, it's been proven to be beneficial. And as you slowly increase your activity over the program, we want you to get to and beyond the recommended 150 minutes of moderate exercise every week. On Mondays and Thursdays, you'll receive links to these 30-minute strength training videos, which you'll do from home. Each of the videos has 9 diverse exercises that use either elastic bands or your body weight. And the idea is that you choose the difficulty level that you want to start with, and as the weeks and months go by, you'll increase the difficulty level. The program is also meant to be modified if you're having problems with a particular exercise. If you're undergoing surgery, obviously you'll have to take a break from the strength training program for at least 4 to 6 weeks, or however long your urologist recommends. The advice from the medical system always trumps the general advice we provide in the program.
Your wife or partner can participate in any of the activities of the program if they like. For instance, the strength training.
Yeah, or going out for walks together again. That was great, getting back to that. Yeah.
The next component of the program, Kegels, also called pelvic floor muscle training, has also been a huge hit in this program, especially for men going through or recovering from surgery and men who have urinary problems. Kegels can also help with erectile and bowel function. We're asking you to do 10 minutes of Kegels 3 times per day. The program can also arrange for you to receive 3 text reminders every day. Each week, the Kegels videos change to make this a progressive training program. You'll also learn key skills which decrease the chance of urinary leakage while training, a skill which you can use for the rest of your life.
The third component is practicing a relaxation technique. The science is very strong that this will improve your mental health and improve multiple other medical conditions. Preferably, you can use a heart rate variability monitor to train your nervous system and actually decrease your stress levels. The monitor clips onto your earlobe and measures the heart rhythm as a way of providing you biofeedback. We'll remind you through an email every day to practice for 10 minutes, and you can also follow one of our videos.
The fourth component of the program is dietary advice. Every day we provide tips in the emails and videos we're sending you to help you transform your diet towards the best anti-prostate cancer diet. We're drawing on the best science and provide practical advice about how to shop and how to prepare those dishes. In addition, we created a series of anti-cancer diet cooking videos where we teach you how to prepare delicious, nutritious, and cost-effective plant-based meals.
The fifth component, relationship and connection training, comes through in multiple ways. Gabriela is a psychology professor with a lot of experience teaching people how to stay more connected with their loved ones. There is a science and methodology to improving our relationships.
Throughout the week, we encourage you to connect more deeply with your loved ones, whether you have a partner or not. We talk about intimacy, sexuality, communication, and how our relationships play a key role in health and healing. There is Walking Wednesday, Touch Tuesday, Call Someone at a Distance on Sundays. We talk about the various types of intimacy and communication techniques. This aspect of the program facilitates and offers a great opportunity to learn key skills on how to connect more deeply with the most important people in your life.
I really liked and benefited from the buddy and mentor aspect of this program. Having a mentor, someone who's gone through this before, and to be able to call them and interact with them was really great for me. Having buddies, people who are in the program, one or two other people where you call once a week and encourage to keep up with the exercises, that was great. We also encourage people to get involved in a local prostate cancer support group in your area, and it's to have other people around you and learn more about how to cope with this disease was very helpful. Once a month we have a conference call where everybody who's involved in the program at the present time get together on Zoom, interact with each other, and hear from Gabriela and Rob, and a real community has developed there.
PC-PEP is free for you to join if you participate in a research study in which we measure your quality of life by an online confidential survey just before you start the program, and then at 6, 12, and 24 months later. In addition, every Sunday during the 6 months program, we would like you to fill out a 2-minute online survey on what you did the previous week. This is important for us because it helps us develop patient education and empowerment programs tailored to patients' needs. In fact, this is how we got here.
The PC-PEP program was really timely for us. It's a very comprehensive program, and it brought us from diagnosis right through all the stages of treatment, and it was absolutely super.
Well, when I started my hormone therapy, I felt like I went from being 57 to 75 years old overnight. But the program gave me some things to do. I got more active. I lost 15 pounds and committed to connecting more together with Pat.
Yeah.
Please join our program by visiting our website, www.pcpep.org. We'll take you through the steps to make sure it's safe for you to exercise and do the strength training, and make sure you have all of the equipment before you get started. And if you run into problems, please email or call us.
We're excited to have you join our program, join our community of mentors, ambassadors, and research citizens promoting this program to other members of the community. This community has grown so much over the past 7 years, here in Canada and internationally, and it keeps on growing. We look forward to connecting and healing with you daily for 6 months and during our monthly video conferences. Take care and get PEP.